Sure, friends. My name is Dr. Amrendra Singh. I'm a Senior Consultant Cardiovascular and Thoracic Surgeon at Citizen Hospital, Hyderabad. Today we'll talk about valve replacement versus valve repair surgeries. Generally, when we there are four heart valves, namely mitral valve, aortic valve on the left side, tricuspid valve, and pulmonary valves on the right side of the heart. Most commonly affected valves are mitral and aortic valves as well as tricuspid valves. These are the most common valve operations in cardiac surgery. So many times a patient comes to us with a choice of whether we have to replace or repair. So there are advantages and disadvantages of both the procedures, but if we see overall advantages of valve repair, if possible, if the technical possibility is there, the chances of recovery as well as long-term survival is much better with valve repairs. With valve repairs, you don't need to, your native valve is repaired, whatever the defect is, we repair those valves with sometimes artificial things or sometimes with your own tissues, so that if it is done properly, it lasts longer, it maintains the heart shape and functions in a much better way than in replacements. And because your own tissues are being used, so there is no need for any kind of anticoagulation in these kind of patients. So many times we give after replacement acid trauma and dual antiplatelets or single antiplatelets drugs, and these drugs have their own complications which can cause the extra bleeding sometimes if their effects are more, or they can cause the thrombogenicity and closure of the artificial valves. So with the help of your tissue only we are repairing these valves, so it is much better, and they don't require anticoagulation in these patients. So their valve function is improved, quality of life will be better, and there will be less amount of medication in the post-operative period. So these are the advantages. But yes, if the valve morphology and the valve pathology is very bad, then definitely valve replacement is a good and long-term solution in your cases. Thank you.